We're going to begin looking at the palpations for the thigh and hip. We're going to start with the medial structures. The first is the gracilis, which comes across here. Next is adductor longus, magnus, and brevis, which come here. And then the pectineus, which is further up in the hip here. Next, we'll look at the anterior structures of the hip. There is the pubic bone, which is located here. There is the inguinal ligament, which is located in here. There's the anterior superior iliac spine, which can be palpated here, and the inferior superior iliac spine, which can be palpated here. Next, we're going to take a look at the sartorius, which comes across the hip, medial to lateral. And then we are going to take a look at the rectus femoris, which is the main quadriceps muscle in the leg here. Next, we'll look at the lateral structures of the hip, starting with the iliac crest, which can be palpated here. Next, we are going to look at the tensor fasciae latae, which is located along the lateral aspect of the hip here, which feeds into the IT band that comes all the way down the leg. Next is the gluteus medius, which can be found right here. The greater trochanter. And the trochanteric bursa can also be found directly over the greater trochanter. Next, we are going to look at the posterior structures of the hip and thigh. The first is the medial sacral crests, which can be located here. Next are the posterior superior iliac spine, which is located right here. Next, we have the gluteus maximus, which can be found here. Next is the ischial tuberosity and bursa, which can be found here, and the bursa is right in there as well. And also the sciatic nerve, which comes and runs down through here. And the hamstrings group, which is located here.